Welcome back to the weekly neurology deep dive. Today we're going to really do a deep dive into a fascinating research paper. It's called Association Between Self-Perceived Stress and Cryptogenic Ischemic Stroke in Young Adults.
Mm.
But before we get started, just a quick reminder that this is for educational purposes only. We're going to be presenting a summary of the research. We're not giving any medical advice or anything like that.
Right. This is not a substitute for reading the full paper. Definitely encourage everyone to check that out.
Exactly. So today we're focusing on what could be a really big deal for neurologists. I mean, have you noticed this potential link between stress and cryptogenic ischemic stroke in younger patients? You know, the 18 to 49 age group.
Yeah, absolutely. And I think it's especially important because there's often, a stigma around talking about stress.
Right.
And this research is really highlighting how stress could be a modifiable risk factor for stroke.
Yeah.
So it's definitely something we need to be paying attention to.
Absolutely. And so this study, it was done across 19 centers in Europe. Pretty big study, huh?
Yeah.
426 patients with their first ever CIS, and they had a control group, right? Same number of people matched for age and sex who didn't have a stroke.
Exactly.
And they measured self-perceived stress with something called the Perceived Stress Scale, PS for short.
Right. A modified version of it.
Right. And they used this to categorize stress levels as low, moderate, or high.
Yeah, based on the scores.
So what we really want to do today is dig into this data. What does it all mean? What's the most important stuff that neurologists like us need to know for, day-to-day practice?
Absolutely. Let's start with some of the overall findings.
Okay, sounds good.
Well, one of the first things they found was that patients with CIS were more likely to report at least moderate levels of stress compared to the control group.
Oh, interesting. How much more likely?
We're talking 46.2% of the CIS patients versus only 33.3% of the controls.
Wow, that's a pretty big difference.
It is. And it was statistically significant, too, with a p-value of less than 0.0001.
So it definitely seems like there's something there. What about when they looked at stress as a continuous measure?
Right. So instead of just looking at those categories of low, moderate, and high, they looked at the actual PSS scores. And what they found was that each 1-point increase on the scale was associated with a 1.04 times higher odds of having a CIS.
Huh. So even small increases in perceived stress seem to matter.
Yeah, that's what the data suggests.
Mm.
And the 95% confidence interval for that odds ratio was 1.01 to 1.07.
Okay, so it's a real finding. Now, what about when they went back to those categories, low, moderate, high? Did they find anything there?
Yeah, they did. When they analyzed the data that way, they found that moderate stress was independently associated with CIS.
Interesting.
The odds ratio for that was 1.47.
And the confidence interval?
1.00 to 2.14. So moderate stress definitely seems to be a risk factor.
Okay, got it. But you said moderate stress, not high stress.
Right, and that's one of the more curious findings. They did calculate the odds ratio for high stress, and it was actually much higher, 2.62. But the confidence interval for that was much wider, 0.81 to 8.45, so it wasn't statistically significant.
Huh. So it's possible that really high stress increases the risk, but we can't say for sure based on this study.
Exactly. It could be that the effects of high stress are less consistent.
Right. Or maybe the study just didn't have enough people in that high stress category to really tell.
That's possible, too.
So did they look at differences between men and women?
They did. They broke down the results by sex and found some pretty interesting differences.
Oh, really? Like what?
Well, for women, higher stress, both as a continuous measure and when looking at moderate stress specifically, was associated with a greater risk of CIS.
So stress seems to be a bigger factor for women than for men.
That's what it looks like. The odds ratio for higher stress as a continuous measure was 1.06 in women, with a confidence interval of 1.02 to 1.1. And for moderate stress, the odds ratio was 1.78, with a confidence interval of 1.07 to 2.96.
Gotcha. And what about men?
For men, either higher stress as a continuous measure nor moderate stress was significantly associated with CIS after they adjusted for all the other factors.
So it seems like stress might play a bigger role in CIS risk for women than for men.
That's a key takeaway, yeah.
Fascinating. Now, you mentioned adjusting for other factors. Can you tell us a little more about the study participants and what other things they considered?
Sure. So the median age of the participants was 41,
Okay.
and a little less than half, 47.7%, were women.
Got it.
Now, to be included in the study, participants had to be between 18 and 49 years old, and they had to have had their first ever ischemic stroke.
Making sure it was really their first one, huh?
Absolutely. And that stroke had to be confirmed by imaging and had to be classified as cryptogenic.
Meaning they couldn't find another explanation for it.
Exactly. And on top of that, they had to have a bunch of tests done within specific time frames.
Oh, wow. That's pretty strict.
Yeah, they had to have brain MRI and basic blood work done within a week of the stroke.
Okay.
And then within 2 weeks, they needed even more tests. Imaging of their neck arteries, echocardiography, Holter monitoring, and thrombophilia screening.
Wow. So they really wanted to be sure they were looking at the right kind of stroke, right?
Absolutely. They wanted to rule out anything else that could be causing it.
So if someone didn't have all those tests in that time frame, they were out.
Right. They were excluded from the study.
And what about if they already had a diagnosis that could explain the stroke?
Yeah. So, for example, if they had antiphospholipid antibody syndrome, they weren't included either.
That makes sense.
They really wanted to focus on truly cryptogenic strokes.
Makes sense.
And then, importantly, they adjusted for a whole bunch of other things that could increase stroke risk: age, education level, hypertension, other cardiovascular diseases, diabetes, alcohol use, smoking, obesity, diet, depression, physical inactivity, even migraine with aura.
Wow, they really thought of everything.
They did.
So that really strengthens the idea that stress itself is a risk factor, right?
It does.
Now, I remember in the paper, they didn't just look at overall stress, right? Didn't they ask about specific kinds of stress?
They did. They also looked at stress related to work, home life, and finances.
Right, right.
And it turned out that certain kinds of stress were more common in the CIS patients.
Like what?
Well, having stress at home for multiple periods or permanently, and moderate or severe financial stress were both more prevalent in the CIS group.
Interesting. So those specific kinds of stress could be particularly important to consider.
Exactly. And when they did more analysis, taking into account all those other risk factors, they found that permanent stress at work was significantly linked to CIS in women.
And what about for the younger group?
For the 18 to 39-year-olds, both permanent or repeated stress at home and severe financial stress were significantly associated with CIS.
So different types of stress might matter more for different groups.
Yeah, it seems that way.
Now, did they do anything to make extra sure these findings were accurate?
They did a sensitivity analysis, they reran the whole analysis, but this time they only included controls from the general population. They excluded anyone who was hospital staff or a proxy for a patient.
And what did they find?
Well, even with that stricter control group, the association between higher self-perceived stress and CIS was still there, both in the overall population and specifically in women.
Okay, so that makes their findings even stronger.
Exactly.
So just to summarize, this study, it provides some pretty convincing evidence that self-perceived stress is linked to cryptogenic ischemic stroke in young adults, especially in women and younger folks.
Yeah, I think that's a really important message for neurologists to take away. We need to consider stress as a potential contributor to stroke, even in younger patients.
Absolutely, even when they don't have those traditional risk factors, right?
Right. I mean, this study was really well designed. They adjusted for so many factors.
It definitely makes you think. Now, of course, this study shows a correlation, but we still don't know exactly how stress might lead to stroke, do we?
Right. More research is needed to figure out those mechanisms. But the authors do suggest some possibilities.
Like what?
Well, they talk about chronic inflammation, endothelial dysfunction, platelet activation, and autonomic dysregulation.
Okay. Yeah, it makes sense that those things could play a role.
It does.
So what do you think? How might this research change how we approach young patients with cryptogenic stroke?
Well, I think it really highlights the need to ask about stress, not just as part of a social history, but as a potential risk factor that we need to address.
Yeah. I mean, maybe we need to be thinking about ways to help these patients manage their stress.
Yeah, absolutely.
It definitely makes you think about the connection between psychological well-being and neurological health, especially in younger folks.
Definitely something to consider.
All right. Well, that was a really interesting deep dive. Thanks for walking us through this paper.
You're welcome.
And for all of you listening, thanks for joining us on the Weekly Neurology Deep Dive. We'll catch you next time.